All right. Welcome to the Nurses as Advocates, a force to be reckoned with session. Today, our presenters are Priscilla Hume, Communications Manager at Campaigns Outreach and Mobilization, and Dr. Winifred Quinn, Director of Advocacy and Consumer Affairs. We wanted to let you know that because we have a high attendance, we did not plan for a Q&A, but you're welcome to put questions in the chat. And we ask that you stay with us until the end of the session for the next steps and contact information. Speakers, thank you. And you may now begin.
Thank you, Patrice, and welcome everyone. Alrighty, there we go. All right, this is just a little bit of overview of where we're going. I'm gonna talk, Wynn's gonna talk, and we'll go from there. First, thank you, Patrice, for introducing. You're gonna get to hear a little bit about Wynn in a few minutes, but I want to just tell you a little bit more about me. Oh, we've got some background noise. If you are not on mute, if you can put yourself on mute. Hopefully we won't have to mute everyone because I don't have to unmute myself. All right, I think we're good. Background noise wise. Thanks everyone. All right, I'm Priscilla Hume. I am coming at you from Colorado and what is a sunny and snowy day today. I work in our campaigns team, communications manager, and I focus on our caregiving LTSS work, mostly at the state level. I'm going to talk to you about all of the advocacy issues we work on, though, and some of the ways that you can get involved. Before we go, though, I just want to explain why I have allowed a picture of my dog in my headshot. I know that's not the typical photo one would see in a presentation, but to show you how important AARP volunteers are to my life, I have included that because my dog Buddy, I actually adopted from an AARP volunteer. Buddy is a service dog flunk out. He's a little too timid and a little too lazy to be a working dog, but 120 pounds of love. And so for that, AARP volunteers hold an extra special place in my heart. And now we will get into the real meat of it. But you've heard a little bit about me. You're going to hear a little bit about Wynn. But we'd love to know a little bit about you. Unfortunately, we don't have time to do full introductions, but we would love it if you could just drop into the chat what setting you work in or what setting you used to work in as a nurse, just as a way for us to get to know a little bit about you.
And maybe what state you're in. I know you did that
would
in
also be great.
Yeah,
that would be great, just to give us a little opportunity to know a little bit about you. Awesome. I see people putting stuff in the chat. Well, welcome everybody, and thank you for all the work that you do. I have no nurses in my family, but my mother is a social worker, and so I spent a lot of my childhood sitting at the nurses station in either a hospital or a nursing home with a coloring book because I was hanging out at work with her. So thank you all for all that you do. All right. Into the meat of it. I'm going to tell you a little bit about our issues and then how you can join us in our fight. So first, I am going to play a short video for you that to me really emphasizes the impact of our work and the issues that we work on. I've shared my sound, so fingers crossed you can all hear and see this as it starts to play.
We lost about everything trying to pay for prescriptions. We spent our whole pension, but couldn't keep up. So my husband just stopped taking his medicine, and then he had a stroke. I can't get back what I lost. But thanks to AARP, a new law will protect seniors with a cap on their prescription costs. That could have changed everything for us. I'm just grateful that no one will have to face the terrible choices that we did.
So for me, that really just emphasized the extreme power of the issues that we work on and the everyday change that we can make in the lives of each other and older Americans and their families. These are very important issues that we work on, and this is why we do what we do. All right. So I'm going to talk a little bit more about prescription drug prices in a second, but I'm just going to give you a super quick overview of some of the different issues that we work on. Whether you're interested in volunteering on an issue that is something you come across in your day-to-day life, if you're looking for something new and different, state level, federal level, we work on just about all of it. So first off, I'm going to mention Social Security and Medicare. I'm sure these are the issues that typically come to mind when you think about AARP and our advocacy issues. AARP has been a long time champion of Social Security because of the importance it plays in the everyday financial security of older Americans and their families. Next up, some additional financial security issues. I think one thing on the state level, we advocate for programs that help to make it easier for workers to save for retirement so they can take control of their future. So maybe retirement savings and financial planning is an issue that's important for you on an advocacy level. Lowering prescription drug prices. So as you saw in that video, AARP led the fight to lower prescription drug costs and we won, but we will not stop fighting until big drug companies until big drug companies out of control prices are at a place where all Americans can afford them, because I think this is a group that we can all agree that medication doesn't work if you can't afford it. And so that's an issue that we work on both the state and federal level. And then family caregiving and LTSS. I'm going to spend a little bit more time on this one because this is my bread and butter issue, and it covers a lot of things. And so under this umbrella, we work on paid family leave and paid sick leave. We work on home care, nursing home care, home and community-based services, respite care for family caregivers, updated power of attorney and guardianship laws, telehealth, a wide variety of issues. And then I think one of the issues that I find most interesting to work on is full practice authority for advanced practice registered nurses. We'll use APRN a lot in this because you're all a group that knows what it stands for, but when I'm talking to different volunteers in a different group of people, I make sure to explain what APRN stands for and give an example, like a nurse practitioner or something, but I don't have to worry about that with this crowd. But that's an issue that I've gotten to work with Wynn and others a lot on. And for AARP, it really comes down to an access to healthcare issue. And nurse practitioners and other advanced practice registered nurses are really a piece to the puzzle for high quality, affordable healthcare when and where you need it for both family caregivers and their loved ones. So that's an issue that we've been working on and winning a little bit here and there in states across the country. And we've gotten to do a lot of great work partnering with nursing organizations across the country. It's really a way, it's really an issue we can come together on and make a lot of progress. With that was a super quick overview on a lot of issues, but I am going to quick give you some of the ways you can join our fight and become an AARP advocate, and then I'll turn it over to Wynn to go over some stuff. But first, aarp.org/get involved. This is where you can sign up to be an e-activist. You can get on the list if you want to be kept informed, to be emailing your member of Congress, to be emailing your state lawmakers. This is really how you can get involved and see what issues we're working on in your state, but also on the federal level. If you are super savvy on your phone and you love to be on mobile, you can text JOIN to 22777 and sign up to be a text advocate. You'll get texted action alerts and when to get involved. AARP.org/inmyshoes. This is a chance for you to share your story and make sure that our lawmakers, that politicians know what it's like to walk in your shoes. What's it like on the ground? If you have stories about family caregiving, if you have stories about Social Security, about high prescription drug prices, share those stories so that we can make sure that our lawmakers know what it's like to walk in your shoes every day. And then at AARP Advocates on Facebook and Twitter. If you are social media savvy, we would love to have you. Join us on Facebook and Twitter. Retweet, stay up to date. It's a great place to see information, to learn more about our issues, and maybe see exactly how you want to get involved. And with that, I'm going to turn it over to Wynn to walk us through some other stuff. I'm going to try to see if there's any questions in the chat that I can answer. But thanks so much.
Thank you, Priscilla, and hello, everyone. Like Priscilla, I am not a nurse. I work on policy issues as they intersect with what patients and families need and what nurses can do and do. And so I'm not going to try to not tell this as a long story, but I was a caregiver to each of my parents in their later years of life, and one of my father's issues pertained to what is known in your world as nursing delegation of medication administration while he was living at home. And if he had not passed away when he did, and if he had continued to live, he would have been admitted into a nursing home so that he could get his care. And it was just because of that issue, because at the time, New Jersey where my father lived, did not allow RNs to delegate medication administration to home health aides. They were allowed to delegate it to others, but in the law, it specifically said home health aides. So fast forward 10 years, I was working in the national office at the Center to Champion Nursing in America, and AARP Colorado reached out to me and said, hey, there's this bill that's going to be introduced in the next session. The nurses want us to support it, physicians want us to oppose it, and we don't want to get caught in the middle. So I read it, and it was about nurse practitioners and what is now known as full practice authority. And I drew upon my experience in terms of scope of what nurses can and cannot do, or prevented from doing because of outdated laws. And I said, hey, Kelly, to me, this isn't about nurses nor physicians. This is about patients and families and about access to care. At the same time, my boss, Susan Reinhart, was having very similar conversations with AARP Hawaii. So we helped both of those states in the next session in 2009 achieve full practice authority. And that really started CCNA in its efforts on helping to achieve full practice authority across the states and at the federal level as much as possible. And so next slide, please, Priscilla. So what we do is, maybe next slide. So monthly, the first Monday of every month at 3 p.m. Eastern, Patrice Little and I organize and host a monthly learning collaborative on access to care. Most months we touch on APRN practice, but there are some that we talk about RN care or institutional level policies. That was a really fun one earlier this year. And in the future, we hope to also focus on access, nurses helping patients and families access services that they qualify for. But if you are interested in joining this learning collaborative, shoot me an email. I have my email address in the chat there for you, and we will get you on that distribution list. And also, if you wanted to advocate with AARP state offices, you go to that AARP.org/get-involved/get-involved link. And I'm sure the AARP state offices would love to have more nurses as representatives on healthcare policy discussions with decision makers. So we also, when we have the capacity to do it, we have hosted, and hopefully in the future we'll host more regional trainings with coalitions of nurses and AARP state offices on messaging training and coalition building. It's one and the same. And so our first message, our first point that we want nurses to become very familiar with, and where they can recite it like they recite now. Most nurses talk about this issue as it affects them. And you know what? It would be much more effective if nurses talked about how it affected patients and families. So think about that. Think about how, if you are already out there in the world, even if you're talking about it with your family, do you talk about how it's frustrating to work with physicians, to have to pay them for your contracts? So, or do you talk about how a patient is missing out on care because this X, Y, or Z issue isn't being satisfied because of the current law? So I said contract purposefully because we'd like to have you talk about how contracts such as what's known as collaborative agreements are really contracts that get in the way of patient care. Those are nothing but red tape and bureaucracy that prevent patients from having direct access to APRNs. And so what happens then? It delays care, the person could get more ill, et cetera, et cetera. So, and we also have been helping nurses build allyship with relevant stakeholders in their states, especially in conservative leaning states. We've done a lot of work helping AARP state offices and the nursing coalitions engage with conservative grassroots organizations like Americans for Prosperity, because they know how to make these points, make the conservative policy points to policymakers. And actually, so Kathy Karsten is on from Nebraska, and in 2015, Nebraska had their full practice authority law passed, and it was the first time that Americans for Prosperity weighed in on any state policy regarding this. And it was from learning from Nebraska that we knew that we needed to provide that idea to AARP state offices and the nurses in the conservative states. Hey, this is a priority now for Americans for Prosperity because they see this as inhibiting access to care, and it inhibits free enterprise. So it's really quite an interesting match, because in other policy issues, AARP and Americans for Prosperity are not aligned, such on Medicaid expansion, right? So, but we align very clearly on this, and it's really great to work with them on this issue. So, of course, and then also in the training, we talk about goals and we talk about which stakeholders in the coalition to engage. And as I said before, we are hoping that in the future, we'll be able to also help nurses engage with everyday people who are in need of services and help them sign up for services. It's a way of increasing access to services. So not so much policy, but direct engagement. And so go to the next slide. Mentoring. Hopefully some of you already in session 1 or session 2 joined my teammate, Jasmine Cooper. She really runs our mentoring programs with historically Black colleges and universities, Hispanic serving schools, and American Indian Alaska Native serving schools. And we do that because we know our nation needs to have a more diverse nursing workforce so that it reflects the population of the United States. We know when there's a larger ratio or a larger group of nurses of color who are serving low-income communities that are primarily made up of people of color, they're most likely to get culturally relevant care. And frankly, it's not just low income, right? Because disparities exist, unfortunately, and no greater example that we can refer to than Serena Williams nearly dying after giving birth because her clinical team did not believe her that she was in pain and that they weren't checking her for blood clots. So, so more diversity will lead to more quality of care and better health outcomes and therefore help to achieve health equity. We engage the federal government on this. HRSA is right out there, right with us at the planning table. We're not advocating for them. They want to, they are very grateful to the communication vehicle we have created that allows HRSA to speak directly to the schools of nursing and to provide technical assistance. And we also work with the National Council on State Boards of Nursing. They have done some train the trainer programs with some nurses that we've identified. They did a train the trainer on the new NCLEX exam that's coming out for the schools of nursing that we serve, who are very under-resourced. And so we have nurses who are prepared to go to those schools of nursing virtually or in person to provide that technical assistance and to prepare the faculty to prepare students for the new NCLEX. So that's it, right? Were we wrapping up at 20 at
Yeah, I think we have 4 minutes left. So here is a couple of links for the Campaign for Action, Facebook and Twitter, and how to get involved with the things that Wynn has talked about, as well as a resharing of all the links that I shared before. You'll get emailed these and they're also in the chat, but you can also just take a picture with your phone, take a screenshot, however you want to save the information. Before we go, I just wanted to say thank you all for your interest in being a volunteer. Maybe you already all are a volunteer and you just want to know more, and thank you for all you did and do as nurses. And it's been a pleasure to spend the afternoon, evening with all of you. Wynn, anything else you want to say before we let everybody go to the ending session?
Deep gratitude on behalf of AARP's nearly 38 million members. Just a very sincere thank you to all the nurses for all that you do for patients and families. And you could do even more in advocacy.
Thank you again, Dr. Quinn and Priscilla, and thank you everyone for joining us for the Nurses as Advocates, a force to be reckoned with session. And you have a great evening and a great Thanksgiving.
Priscilla, thank you so much. Oop, go ahead, Catherine.
I was going to say, please head back to the closing session, back to your main site.
Yes.
Great.
Yes.
Thank you, Catherine, Patrice, and Priscilla. And thank you,
Thanks,
everyone.
Wynn. Amazing. Go team.
Go team, go.